Okay, we're going to continue our lecture on drug calculations. But this time around, we'll be looking at tablets. Well, this is one of the simplest parts of drug calculation because of how direct the questions used to be. And of course, even in real life, they are usually very simple. What I mean by being simple is it's more or less a comparison. Let me use a form of comparison to explain to you. When it comes to tablet calculation, it's usually telling you how many tablets will be administered to a patient, or will you administer to a patient, right? If the dose has been prescribed for you, either in milligram or grams. So what you are doing in tablet calculation is simply the equivalent of the dose that have been prescribed. How many tablets are you going to remove from the sachet that will be equivalent to the amount that has been prescribed? Take for instance, if I say a patient should be administered, let's say 1000 milligram of paracetamol So 1000 milligram of paracetamol. This is what the prescription sheet is reading, or what I am to administer to my patient. But of course, since it's tablet, how many tablets will I remove from the sachet that would be equivalent to this 1000 milligram? So that is just what we are going to be doing under the tablet calculation. It's very simple. It's very simple. We're going to look at a series of examples that I believe is going to help us. But one thing we need to take note with regards to tablet calculations is that you will have to be careful with the unit. Now, what I mean by unit is you always ensure that the unit that has been prescribed for you should also be the same with the unit of the tablet. Should also be the same with the unit of the tablet. Now, what do I mean by this? Now, if you look at tablets, if you pick any tablet, you will always see the amount of each tablet. It will be written on the back. Like in the case of this one, this is glibenclamide. Now you can see 5 milligram is written. That is to say, each tablet of this glibenclamide or Daonil is the trade name. Each tablet of this Daonil or glibenclamide is what? Is 5 milligram. Now, if you look at another one, let's say this is metformin. This is metformin. And if you look at this, we have 500 milligram written. You can see 500 milligram written. 500 milligram is written. So that means each tablet of this metformin is 500. It does not. The meaning is not that all of the 10 tablets is 500. No, each tablet amounts to 500 milligram. Not all the 10 tablets are all together. So likewise, the glibenclamide I showed you is not the 10 tablets that is 5 milligram. No, each tablet is 500 milligram. Now let's take paracetamol. This is paracetamol. I don't know whether you can view it. You can see it clearly. You can see 500 written. I believe if you need to see it, you see 500 is written. Now this 500 simply means each tablet of this paracetamol is 500 milligram and not the total 10 tablets in that sachet altogether. So now this will take us quickly to the formula that we are going to be using. So of course, we'll still continue with this book. This is the reference book I will be using. That is Calculations in Pharmacology for Nurses. For this topic, you will go to page 30. It's on page 30. That is those calculations. In bracket, you have tablet. So this time around is tablet, and it's on page 30 of this reference material. Now, the formula to calculate or to know the number of tablets you are going to remove or administered to your patient is given like this. That number of tablets, let me use NO as number of tablets, either tablets or tablet as the case may be, is given to be amount prescribed prescribed over amount in each tablet, amount in each tablet, amount in each tablet. So this is the formula that we can use to get or to know the number of tablets you are going to remove when you are to administer any tablet to a patient. Now this is the formula. Number of tablets or tablet as the case may be is equal to amount prescribed. Now this amount prescribed is the amount of the tablet that has been prescribed. It can be 1000 milligram, it can be 500 milligram, it can be 2 microgram, it can be anything. But this amount is what has been prescribed for that patient to take. What has been prescribed for that patient to take. So if the patient has been prescribed 250 milligram, right? Of course, we are going to put the amount prescribed here as the numerator. Then denominator is amount in each tablet. I've just shown you a few minutes ago. Each tablet you pick, right? The amount is already written at the back of that tablet. Any drug any tablet you are picking, whether tablet or capsule, if you want to know the number of each tablet, you always find it on at the back of the sachet, just we have shown you earlier on. So this is another metformin. You will see. Now if you look at this metformin, this glucophage, you will see each tablet is 500 milligram. Each tablet of this metformin is 500 milligram. It's 500 milligram. You see, it's always written. Any tablet you pick at all, you will see the amount in each tablet. You will see it. You will see it. So whether you have administered the drug before or not, this particular topic, you can do it even when you have never administered that drug. All you need is what? To have the tablet with you or the capsule with you, the sachet. Then just turn to the back, you will see the number of each tablet. Once you have that information, the next information you need to have is the amount that has been prescribed for that patient, which of course will be in the prescription sheet or any other place where the information is. So now this is the formula. Now let's quickly take some examples. Now let's take a real life example that we are used to. Let's say a patient who is having serious headache, right? Maybe due to stress and some other factors is having headache, a very serious one. And of course, the patient is to take 1000 milligram or 1 gram of paracetamol tablet. Supposed to take 1 gram of paracetamol tablet. So how many tablets am I going to remove that will be equivalent to that 1000 milligram or 1 gram? Now let's take, for instance, let's take our information. If the patient has been prescribed 1000 milligram of paracetamol, right? And in each tablet of paracetamol, is 500 milligram. If you can see it, it's here. Each tablet is 500 milligram. So if each tablet is 500 milligram, right? That is to say, I can apply this formula to get the number of tablets I'm going to remove to administer to this patient. Now, what I was saying previously is to ensure, always ensure that the unit for the amount prescribed should always be the same with the unit in each tablet. That unit of the tablet, in unit of the amount in each tablet, make sure the unit is the same. So in the case of this, the amount prescribed is in milligram. Then we look at the sachet also. Amount in each tablet is also in milligram. So in this case, we are very, very good to go. We have no issue with regards to conversion. So we can apply the formula straight away. But there are certain situations, especially in exam situations, where amount prescribed can be in another unit. Then when you look at the sachet, you'll be seeing a different unit. So in this case, you'll have to do some little conversions. So I think we are going to look at examples that have to do with that later on. So now, so this is 1000 milligram and this is 500 milligram. Now, if we apply this formula, amount in each tablet will now be, amount prescribed is 1000 milligram. This is the amount prescribed. Then over amount in each tablet, we have also mentioned that amount in each tablet for paracetamol tablet that we just saw is 500 milligram. So this milligram will go. Now 500 here and 500 here will give you 2. So that is to say the patient is going to take 2 tablets. So the number of tablets this patient will take is what? Is 2 tablets. So that means 2 tablets is equivalent to 1000 milligrams. It's equivalent to 1000 milligrams. If I don't even need somebody to tell you this, or it's not, if not for for sake of calculation, ordinarily you should have known that 2 tablets should give you 1000 milligrams. Since each tablet already is giving you 500, when you sum 2, it gives you 1000 milligrams. But of course, in exam situations or sometimes in real life, since it's drug, you have to put pen on paper to be sure that yes, you're not speaking from yourself. You are speaking from what you have seen and what you have calculated. I think it's better that way. So let's take examples from the reference material. So let's pick example 1 here. Now I'll read the question, then later I will solve. Now, as I read, I will take down the data or the information here so that we can do the calculation much easier. Now, example 1 says, if 70-year-old male patient with a history of heart failure and atrial fibrillation is prescribed digoxin 0.5 milligram orally daily. So now the drug is digoxin 0.5 milligram. That is the amount that has been prescribed for this patient who is having heart failure and atrial fibrillation. So now amount prescribed is now, let me use PR as prescribed. Amount prescribed is 0.5 milligram. That is the amount prescribed for the drug digoxin. Now, 0.5 milligram orally daily to help manage his symptoms. Full stop. The pharmacy provides digoxin tablets in a strength of 0.25 milligram. The pharmacy provides digoxin tablets in a strength of 0.25 milligram. Now, the pharmacy provides digoxin at what? At 0.25 milligram. Now, what this aspect of pharmacy means is the drug that has been given. Each tablet of it contains 0.25. Each tablet of it contains 0.25. So if each tablet is 0.25, because that is what is obtainable or present in the pharmacy. So automatically this will be the amount of each tablet. So 0.25 is now the amount in each tablet because that is the amount that is available from the pharmacy. So with this information, we can quickly apply this formula and know the number of tablets. But one thing you need to take note is the unit of the amount prescribed and the amount in each tablet that we have obtained from the pharmacy, they are both in milligrams. So 0.5 milligram and right little one is also in 0.25 milligram. So both of them are in milligrams. So there's no need for conversion. And since there's no conversion, we can apply the formula straight away. So let's quickly use this. Now the number of tablets will be amount prescribed. The amount prescribed is 0.5 milligram. Then amount in each tablet is 0.25 milligram. 0.25 milligram. So how many tablets will this be? So automatically this will give us about 2 tablets. It will give us 2 tablets. 2 tablets. So that is to say, if what I have as my amount in each tablet is 0.25 and 0.5 has been prescribed, so 2 of these 0.25 will give me 2 tablets. Tablets. So let's take one more example that has connection with conversion. So let's pick example. Let's see. Let's see. Let me check from the practice question. If you can have questions that has connection with conversion, then we can quickly convert and see. Okay, I think I've seen one on page 66. On page 66, question number 39. Question number 39. Let me read the question, then we'll solve it. It's still on the digoxin, but this time around, the units are not the same. Now, a patient is prescribed 0.25 milligram of digoxin orally once daily. Now, how many tablets should you give? So what we are looking for is the number of tablets you should administer. Now, the question continues by saying stock. That is to say, what is available in the pharmacy or what is available in your possession is digoxin, which is digoxin, but this time around is given at 250 microgram. 250 microgram. So that is to say, what you have in the pharmacy shop or what you have in your possession, as the case may be, stock can simply means what you have in your possession. So it can be in the pharmacy or it can also be with you in the world. So that is, the dioxin is 250 microgram. That is the amount for each tablet, the one you have. And the precision is reading 0.25 milligram. So how do you go about this? You can see the amount prescribed is in milligram. The amount in each tablet is in microgram. So we have differences we have a very significant difference with regards to the unit. So that means it's either we convert the amount of each tablet to milligram, or we convert the milligram, which is the amount prescribed, to what? To microgram. So anyone, you still arrive at the same answer. So let's pick anyone. Okay, let's say we are converting to the unit of amount prescribed. Amount prescribed is in milligram. So let's convert our microgram to milligram. Now, if you can remember, there is a very strong connection between microgram and milligram. And what is the conversion? There is a connection. 1 milligram is the same thing as 1000 microgram. So this is the connection. So if there is a connection between milligram and microgram, and we know that 1 milligram is the same thing as 1000 microgram, and I'm converting microgram to milligram. So what will be the equivalent of 250 microgram in milligram? So if you cross multiply, you have x will give you 250 divided by 1000. So this will give us 0.25. So automatically we have converted 250 microgram to milligram, and the answer is 0.25. So this is the basic way you go with regards to the conversion. Since I've already established previously that 1 milligram is 1000 microgram, and you have 250 microgram rather, 250 microgram. So what will be the equivalent of 250 microgram in milligram? So when you cross multiply, you have 250 over 1000 to give you 0.25. So that means the unit of amount prescribed and the unit of the stock strength now, or what we have in our possession with regards to the tablet, each tablet is now 0.25. So quickly, we can apply the formula. Our number of tablets will now be, amount prescribed, remember, is 25 milligram. And what we just calculated, amount in each tablet from 250 microgram is now 0.25 milligram. So at the end of it all, we have one tablet. So one tablet of digoxin is the same thing as 0.25. So we are administering just one tablet. So this is an example. I believe we still have more examples in the practice questions. So you should go through and solve all of them.